Hello, welcome to this video. My name is Ida and I am a pharmacist. The topic of this video is headache. Headache is very common. It affects all group of people. Some headache will go away after a short period of time without treatment or with an over-the-counter pain reliever. Other headache, for example migraine, may be more severe and you may need to have treatment prescribed by a healthcare practitioner. But most headaches are not caused by serious health problems. For example, tension type headache, which I will be explained in this video. Tension type headache is a type of headache that lasts 30 minutes to 7 days. It may be caused by many things, not only tension. You may even get a tension type headache if you have a cold or the flu. But this headache usually goes away on its own, but pain reliever might help you. So, what are the criteria to look for? In tension type headache, you need to at least have 2 of these following criteria that I will be mentioning in the next part. For tension type headache, pain may be on both sides of the head or across the forehead. It often feels like there is tightness or pressure in your head and sometimes in the shoulders and back of the neck. The intensity tends to be mild or moderate. And lastly, it is not aggravated by routine physical activity. Although it goes away on its own, what else can you do? You can take a pain reliever, namely paracetamol. I will mention 2 brands in this video, which are Simple Pharma, our local manufacturer in Brunei, and Panadol. Paracetamol can be bought directly without seeing the pharmacist. The available packaging are blister pack of 10 for both of the brand, a bottle of 100 for Panadol brand, and a bottle of 200 for Simple Pharma brand. What about the dose? Each tablet contains 500 mg of paracetamol. Normal dose is 0.5 gram to 1 gram every 4 to 6 hours. In other words, take 1 or 2 tablets every 4 to 6 hours. You can only take a maximum of 8 tablets per day, and please do not take more than the recommended dose. How do I take it? To take paracetamol, you need to swallow the tablets as a whole with a drink of water. You need to wait at least 4 hours before taking another dose. And please do not take more than 4 doses in any 24-hour period. How about the storage conditions? You should store your medicine in a cool, dry place and preferably in an airtight container, away from direct sunlight or heat and appliances which emits heat. And always store your medicine out of sight and reach of children and pets. Before taking any medicine, please check the expiry date shown on the pack. The expiry date refers to the last day of the month. Do not throw away any medicine via wastewater or household waste. Please ask your pharmacist how to throw away medicines you no longer use. These measures will help protect the environment. I'm taking paracetamol. What should I be aware of? You should aware that the limit used to paracetamol is less than 15 days in a month. This is to avoid medication overuse headache. And please do not take paracetamol with any other medicine containing paracetamol. If you're a patient on warfarin, a blood thinning medicine, please consult with your doctor first. And lastly, please try to avoid alcohol while taking paracetamol. Another way you can relieve your headache is by resting in a dark, quiet room and applying a cold or ice pack to your head. What lifestyle changes can I do? Maintaining regular sleeping and eating schedule, as well as managing your stress, can help you with your headache. When should I see a doctor? You should see a doctor when you suddenly have a severe headache that is worse than any you have had before. Number 2, when you experience a new or unusual type of headache. Number 3, when there is a change in your usual headache pattern. For example, headache that happen more often or become severe. And lastly, when you start to have headache in middle age or later, which is in the age of 40 and above. It's almost at the end of this video. I hope it's been very informative and are easy for you to understand. Before ending, I would like to ask the viewer 3 questions. Question number 1. What medicine can you take to relieve your headache? Answer to question number 1 is paracetamol, and the 2 brands mentioned in this video is Simple Pharma paracetamol and Panadol paracetamol. This paracetamol you can easily get over the counter without seeing the pharmacist. Question number 2. Can you take another paracetamol containing medicine when taking paracetamol? The answer to question number 2 is no. So, please be aware that you should not take paracetamol containing medicine with paracetamol. Lastly, question number 3. When should you see the doctor? Answer to question number 3. You should see the doctor when you suddenly have a severe headache, when you experience new or unusual type of headache, when you notice changes in usual headache pattern, and when you start to have headache in middle age or later. Good job to you if you managed to answer all 3 questions. If you don't, answers are all explained in this video. I would like to say thank you for viewing my video, and I hope this video is easy for you. My name's Ida, and goodbye.